Then it's my great pleasure to introduce our last speaker tonight, Professor Alina Popescu from Timișoara. And I want to ask her also, there are some questions in the audience concerning hemangioma, adenoma, regenerative nodules, statosis. So I think Alina will give you a brief glimpse of all the focal liver lesions. Please, Alina.
Thank you very much for the introduction, and welcome everybody to this webinar. It is my task now to talk about a different approach, and I'm not going to talk about liver metastasis or about HCC, but I'm going to talk a little bit about the characterization of focal liver lesions and mainly how to use it in clinical practice. One of the important aspects regarding ultrasound is that it's a very good imaging modality for detection of focal liver lesion. The problem is that it lacks specificity. So you detect it, but you are not going to be able to tell for sure what kind of lesion the patient is facing. And of course, if you tell a patient that you have a tumor in the liver, this is going to be stressful. There are some limitations of the technique that are already known, that it's operator-dependent method, and you need an acoustic window in order to be able to see the lesions. But it's also a technique that has several advantages that were already mentioned here, that it's a relatively cheap method, no irradiation, you can repeat it, it's very accessible, and actually it's the only real-time imaging technique. After you have established that probably the patient has a focal liver lesion, usually the evaluation of this can be very expensive because you are going to need other imaging techniques, and it's also stressful for the patients. Contrast enhanced ultrasound actually brought something new in ultrasound and changed the paradigm of this situation. It was developed actually to overcome some of the limitation of the conventional B mode and also Doppler ultrasound techniques for the liver, and actually it's enabled to display the structure, the vascular structures of the lesions. You can follow the enhancement patterns of the lesion during the phases that you have already found, that we have three phases, the arterial, the portal, and the late one, and by this you can characterize the lesion. The contrast agent stays in the vascular space, and by assessing the patterns in real time, usually you have a very good resolution, temporal resolution, as compared to the other imaging techniques where you are judging actually the image, the still image in time. You have already found out that there are several papers that are available to you, the guidelines for the use of contrast agents for the characterization of the lesions in the liver. So in 2012 were the last guidelines regarding the liver that were published. All these publications are available on the EFSUMB website, so feel free to look in them because you are going to find all the information necessary if you are going or you're planning to use contrast in your activity. Remember that it's one of the most important parts regarding the use of contrast enhanced ultrasound as compared to the other imaging techniques is that you have the patient, and it's all very good that you know before you are performing the contrast studies, the patient demographics, the clinical history, all other pure information that you have, also imaging techniques. The other thing that you have already found is that it is important to know if you are facing a cirrhotic or a non-cirrhotic liver, because you are going to judge the lesion that you are characterizing and you are looking at by contrast study, if the lesion appeared on a healthy liver as compared to if it appears on a cirrhotic one. When it is indicated for lesion characterization, whenever you find incidental findings of the routine ultrasound, and here it is a very good method because it adds actually 5 minutes if you can do it in the same time as the ultrasound study. it adds only 5 minutes to the ultrasound study, and you are going to be able to give your patient more information regarding the lesion that you have detected. You can use it whenever you have lesions or suspected lesions that are detected on ultrasound in patients with a history of malignancy as an alternative to CT or MRI. Whenever you cannot do CT or MRI because there is a contraindication for the contrast that we use in both techniques, and it is also useful when you have inconclusive imaging techniques or inconclusive cytology or histology. And actually, we base the diagnosis on some very important parts. Remember that we use the late phase in order to establish if the lesion that we are looking is a benign one or a malignant one. Why? Because when we are talking of benign liver lesions, there is a sustained enhancement in the portal of the late phase. So if you look here, you are going to see this. This is a table that is regarding the benign focal liver lesions. And we use actually the arterial phase for further characterization. So we use the enhancement patterns that we have in the arterial phase during the arterial phase to say what kind or to establish what kind of lesion we are facing. Why for malignancy, you have already found out that the late phase is also the most important one, because the hyperenhancement of the solid lesion in the late phases is the corresponding actually washout phenomena is the one that is characteristic for malignant lesions. So from the beginning, if we have a incidental finding, we use the late phase to establish if it's benign or malignant. And actually we use afterwards the arterial phase to characterize what kind of focal liver lesion we are facing. I'm not going to talk about HCC or metastasis because you have heard a lot of information in the previous presentation. You have heard also about benign focal liver lesions. Here you have an example of a hemangioma. This is the most frequent focal liver lesion that you find incidentally in the liver, and sometimes can be very stressful because not all the time you are going to be able to tell the patient that probably it's a hemangioma. What is typical for the hemangioma is the pattern in the arterial phase, the peripheral nodular enhancement that is typical for this lesion. And also, if you look in the late phase, here you establish that it's a hemangioma and it's not a malignant lesion because it's still enhancing. Sometimes if the lesion is large, you are not going to complete the enhancement. So the central part of the lesion is going to stay without contrast because of the thrombosis that can appear in that area. If you have faced focal nodular hyperplasia, for example, this is a lesion sometimes pretty difficult to see also in the conventional ultrasound, but as a rule, if you characterize by contrast enhanced ultrasound, if you look in the arterial phase, you have a hyperenhancing lesion that has a spoke wheel aspect. So the enhancement starts in the middle of the lesion and goes centrifugal. And this is typical. And also, if you look in the late phase, is not going to lose the contrast. So it's still hyperenhancing or isoenhancing in the late phase. While, for example, if you have other lesions, this is a complex lesion where the clinical pattern is very important. So if you find such a lesion in a patient that had fever, you are going to think about a liver abscess. So it's very important to have the information regarding the patient before you do the contrast study. And when you do the contrast study, if you have this enhancement with septation inside that are enhancing in the arterial phase with the aspect of a honeycomb appearance, while in the late phase, sometimes it's a little bit hypoenhancing rim, but still the central part will remain in all phases. Without enhancement, you have the positive diagnosis of a liver abscess. And again, it's very, very important, the clinical aspect, because you are going to judge this patient knowing which are the clinical features that brought the patient to the doctor. You have already found some of the information that I'm going to tell you next. The technique is on the market for a long time, and there are a lot of studies that showed that it has good performances regarding the characterization of focal liver lesions. And there are also meta-analyses that are available. This is one of the first that appeared in 2011, and it compared contrast-enhanced ultrasound to contrast-enhanced CT and contrast-enhanced MRI for characterization of focal liver lesions, and show similar results. So the sensitivity and the specificity of all techniques were pretty the same. And this is why the authors concluded that this technique should be considered the first choice for patients with limited financial support. It's also one of the easiest way to approach the patient, because you don't need to send the patient to another technique. You can perform by yourself the investigation immediately after you have performed the ultrasound investigation. In 2013, another meta-analysis was performed that included around 8,000 focal liver lesions. And here they look at the overall sensitivity and specificity for contrast-enhanced ultrasound for diagnosis malignant liver lesions, and showed a very good sensitivity, 93%, good specificity, 90%. They had also 7 studies where they were able to compare contrast-enhanced ultrasound to CT or MRI, and actually they showed that the specificity was the same, while the sensitivity was significantly higher for contrast-enhanced compared to CT or MRI. And again, they concluded that it's a good method for the workup of patients with focal liver lesions. The last one was published in 2018, and they looked for the differentiation between malignant and benign focal liver lesions, and they showed very good pool sensitivity and specificity for stratifying the risk of malignancy in focal liver lesions. So it's a very good method that can tell you, even if you cannot establish the positive diagnosis after the contrast study, you can be pretty sure if the lesion it's malignant or benign. And this is one of the questions that the patient is going to have after you have detected a lesion inside the liver. There were other studies that looked at the value of this technique when you examine unclear findings on computer tomography, contrast-enhanced CT, or contrast-enhanced MRI. And this was a retrospective studies in 146 patients that had at least one focal liver lesions. And they showed that they had good sensitivity and good specificity to correctly characterize the lesion as malignant or benign. So to establish which is the situation, if you have a benign focal liver lesion or a malignant one. All these data lead to the commentary of the experts that showed that contrast-enhanced ultrasound is a good method that allowed a very rapid evaluation of the nature of the focal liver lesions. It is very good for differentiation between malignant and benign focal liver lesions in healthy liver parenchyma. And you find out that it's a little bit different when you are facing a cirrhotic liver, and again, then you are going to have the clinical information regarding this. It has advantages because it's not costly as compared to the other imaging technique. There is no radiation, there is no nephrotoxicity. Actually, the contrast, you can use it also in patients that have renal failure, and is the only one that gives you a real-time imaging evaluation. So actually, you can see in the arterial phase what happens with the contrast when it arrives in the liver and in the focal liver lesion. It can be an alternative to those situations where the results are unclear, and it's very good also in this situation. So I hope we were all able to convince you that this should be the first imaging modality that you use for the evaluation of a focal liver lesion that is discovered in an ultrasound examination, because in many cases you are going to get a lot of information for your patient in a very short time and with very low risk. And it's a very useful method for characterization of focal liver lesions with a sensitivity and specificity quite similar to CT or MRI, but with a lower cost. And I hope that it was useful for you, or all this information were useful for you, and if you have any other questions, I'm going to be very happy to answer them. Thank you very much for listening.
Thank you very much. So my last comments before I thank all the attendees, my last comments were that the contrast agent used by all three of us is SonoView. Sonazoid is not available in Europe, maybe with the exception of Norway and Denmark. We are all using SonoView, and it is marketed in the United States as Lumason. The dosage is 0.03 ml per kilogram for pediatric patients. That's the registered dose by the FDA. So you can use in between 1.2 and 2.4 ml for pediatric patients. Then one last question for all the panelists is, how often do they use quantification? That's the last question.
So I can tell you that from my point of view, we don't use so frequently quantification in clinical practice. We use it when we follow our patients after treatment, usually. So this is the most important indication for us, but we use a lot of contrast in daily practice.
Yeah, so yeah. I think we have to end it here. I want to thank again all the attendees. There were more than 200 at one point. And I want also to thank both Alina and Fabio for their presence. All of us can answer questions by email. So please feel free to send any questions by email, because I think all the networks are a bit overloaded and we have some slight technical problems. So thank you very much and have a nice evening. Stay safe, all of you. Bye-bye.
Thank you. Bye.
Bye-bye.